some of the reason that there hasn't been enough discussion about these mRNA COVID-19 vaccines is because there's a perception among some people that President Donald Trump is somehow responsible for this. I want to make it very clear. President Donald Trump, last I checked, he didn't go to medical school. Okay, he doesn't have a PhD in epidemiology or virology or immunology. His job was to lead the nation, and he did that the best way he could with the information he had. The people who are responsible for the carnage that we are witnessing, and frankly, that whether we witness it in a way that we know or witness it in a way that is unknown, and I'm talking about people who die suddenly or die unexpectedly or for whatever reason, but they're no longer here to speak, right? So that story goes away, except in the minds of their loved ones. The people who are responsible are the people who had the training, who had the scientific training, the clinical training, the training in data to be able to know when things are risky, to be able to know how to properly evaluate new products. Those are the people who are responsible. Dr. Anthony Fauci is one of the people that are responsible. And frankly, every physician who decided to bury their head in the sand instead of facing up to the fact that the patient in front of them has some condition that could or probably was related to their vaccine injury, they are responsible. We all share, to some degree, a level of responsibility when we have training and expertise in this area. President Donald Trump is not responsible for the carnage that we have seen. He did the best that he could with the skills and the training that he has. Trying to protect President Trump is not a reason to not take care of the millions of people who have been injured by these mRNA COVID-19 vaccines. We have a duty to do that. We absolutely have a duty to do that as clinicians, as scientists. We must do what we can. It is the ultimate travesty to allow this to continue to fester in the background without adequate attention. So today I want to call on the federal government, NIH, to expand the work that they are doing in long COVID to genuinely and wholly include vaccine-injured people, specifically people who have been injured by mRNA COVID-19 vaccines. We need to study this better. We need to fund physicians who are caring for these patients clinically and who are doing scientific work in this area. And we need to create networks that allow physicians to do what they are trained to do. And you do that by facilitating communication, exchange of data, and exchange of ideas. And it is long past time. I mean, this is a terrible tragedy that it's still happening, even though we have a change of leadership. It is a terrible tragedy. So that's what I'm calling on the federal government to do today.